All right. Good afternoon, good evening, good morning, everywhere you find yourself. Welcome to Sickle Life. Let's Talk Sickle Cell Initiative um, by Sickle Life. Our program is beginning now, and today it's going to be exciting. I want everyone to brace yourself to your seat and just make your notebooks, your pens ready, and everything because today is going to be a great learning for all of us. And we're going to learn about so many things about people with sickle cell and mental health, actually. Today, our speaker is a well-knowledge person that is well-vested in mental health and has vast knowledge in mental health. So I believe she'll be able to dissect and bisect and trisect everything about mental health relating to Sickle Life. My name is Citizen Kofi, and my co-host is Priska, also known as Miss World, also known as Sexy Sexy on our platform. So we co-hosting this program together. So on that note, today our talk is going to be let's talk sickle cell and mental health, sickle cell and mental health. But before then, I would like to define what health is so that we take it from that trajectory. WHO define health as a state of complete physical, mental, the mental is underlined, and social well-being, and not merely the absence of diseases or infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, and social condition. So if we look at this definition by WHO, we as individuals need to have the best as we should have. And as people with various sicknesses, especially sickle cell, we need to have the best of our life and the best of treatment and the best of care everywhere. So today we are talking about mental health. I would not like to define mental health or go deep into mental health because we have a resource person going to talk to us on mental health and sickle cell. So I want you to before we start the panelist discussion, or I would like you to put your questions. If you have any questions, please, if you're on Facebook, you can put the questions in the chat box and your question will be addressed. You can put your question in the chat box. If you are on our support group, you can also put the question on the support group and your question will be asked. If you are on the Zoom line, we would also ask you to put your question in the chat and we can ask the question. At the time that we asking for questions, you can also raise your hand and we'll give you the opportunity to ask your questions. So there are all these avenues for you to ask the questions. Mostly we get done and people are like, oh, we couldn't get ask our questions. We don't want it to be that way. So there are all these 4 platforms that you can ask your questions now, and we move ahead. So before then, I would like to know if Miss Priska is on the line, who can share her story about her mental health, what she went through as a person living with sickle cell. Priska, are you on the line?
Yes, sir, I'm here.
All righty. So find a good place and stand and please talk. Tell us what you experience with mental health as a person living with sickle cell.
Okay, thank you very much for the opportunity. My name is Priska, and I would like to share my experience with you. Okay, so it's a very long story, but I'll try my possible best to make sure I summarize everything for you guys. Okay, so this happened way back in 2014 when I completed it SHS. After a month of completing SHS, my dad passed away. So when dad passed away, you know African families, during the funeral rites, they said they have to bath us with the sponge they used to bath the cough.
Okay.
We are 9 children from that side, and 3 of us are sickle cell. So all the 3 of us, they have to use that sponge that they used to bath the cough to bath us. And that's where the whole saga began. So my mom said she won't agree to this and won't allow me to do any write-off. So I have to hide from the family, from one location. She has to take me to her friends to keep me there. And I didn't see my family for months. And even after the funeral was over, that we thought, oh, all was over. Someone told my mom that she should take me somewhere where she think I'll be healed from this sickle cell thing. Then she also did that. And where we went, I'll say it's a church, but I have to stay there for 3 months. And all I do, they don't even give me food. All I do is to eat fruits and water. So one day I asked my mom, are you happy with the results we are getting? Because our money too is going. Like my mom used to have a supermarket, but she lost it because of this situation. She has to be selling the things in the supermarket to take care of me. So I asked her, are you happy with this result? Because we are not getting, I'm still a sickle cell. It doesn't, my genotype has not changed. Are you happy? And you want us to stay here because I've completed SHS and I need to continue or move on with my life. Then she told me that all is well, but we should have patience. So patience for how long? I was still kept there and we came back. So she herself, she realized that I'm getting worse because I can't walk, I can't do anything. I have to be even fed. If I'm supposed to wee or something, I was on diapers. I can't do anything for myself. And I was just there, like I'm dead, but I'm living. So I was, at long last, I was able to convince her to take me back home, or better still, to the hospital. So the day we arrived in Accra, we came back to Accra and she had to take me straight to the sickle cell hospital because I was not doing anything then. I only talk and maybe she feeds me, that's all. We came there and they took care of me. I was getting better. So I have to start my life, living my life again. That time I gained admission at Accra Poly and I lost the admission because by the time we came back from wherever we went and from hiding, they said the admission is over. So I have to just hold on. So I was back in the house and all my one of the people like I see as a support system. So I overheard a conversation with my mom that why is it that I'm giving her so much trouble? She has lost her job, everything she has because of me, one sickness. So why is it that I'm a burden to her? Why won't she kill me so that everything will just end? So when she said that, they didn't know that I had it. So to make it easier for them, I tried committing suicide. Yes, I took all the medicines or drugs available, like everything, any medicine I laid my eyes on, I just swallowed them. But I wasn't lucky enough. I was sent to the hospital and it was flushed out of my system, and I'm still living. Fast forward to 2016, I gained admission to do a journalism course, and life is moving on. I just, I don't know where I found the strength to keep living, but I guess I have to leave because I'm still not dead and I'm still here. So that's the little thing I know about. And I was really depressed and sad in those days. You could talk to me and I would not hear anything. You might think I'm not paying attention or something, but I'm not, I'm just not there. And I don't feel like doing anything. So that's what I also went through.
Wow. Thank you very much for sharing this story. You know, when you've not heard someone's story, you think you are the only person in the soup. But look, in African soup, there are a lot of meat there, and you have to exploit all. Thank you very much, Priska, for sharing this touching story. I'm just touched this afternoon, and it's it's kind of difficult, but I hope it will be addressed. So we're going to our second panelist, who is Celine. Celine, if you're on the line, you can unmute yourself and just give us a brief of your mental health experience with sickle cell. Hello, Celine.
Yeah, citizen, I'm online. Good
All right.
evening.
Good evening.
I'm Celine. Mine started after I lost my mom somewhere 2007. And I just couldn't accept the fact that my mom was gone. So I was in the denial. Everything was moving on. But after the funeral, I was like, something is missing. Where is mommy? And all that. And then my siblings just didn't understand the fact that I was the only sickle cell amongst them. So I was close to mommy. They felt that mommy was over pampering me and stuff. So it was now time for them to punish me a bit because now mommy is not there. And it affected me greatly. I lived in the house trying to get love from my siblings. Sometimes I have to go out, get money from people, buy food stuff, bring home, and do a whole lot of stuff at home. Got so sick, get to the hospital, and no one ever visited me. Till date, none of my siblings ever stepped in the hospital to visit me whilst I had a crisis. It got worse when I got admitted at Ridge Hospital and my brother was called. When he was called, he was like, "Oh, she's already dead. She was born dead. So if I waste money on her now, what will I use to buy coffin when she dies?" And just that statement broke me. So it got to a time, my I have two elder brothers. The second one, he got drunk one night, came to the house, and then with all threats, he'll kill me because I'm already dead and I'm a liability to the family. They don't have money to waste on me. He tried killing me that night, and fortunately I could escape and report at the nearest police station, and I left home. When I left home, I couldn't come back. I had to live in the streets, like I have nowhere to sleep. And I was raped once, and all this, like every time I sleep, I get nightmares of my mom dying over and over again. Like I'm trying to save her, and she dying. I I don't even know how to continue with this. And then this rape issue also came in, so it became something really big. Um, Saturdays I have to go to the market and then get stuff from the market women like clothes and then sell. And after every week, the money I get, I have to take it back to the hospital. And the dreams kept coming. Then later it was like hallucination. I kept hearing voices. You are a failure. You're going to die. Nobody's going to save you. All those things. So I could just lock myself up in a room and like for 3 days, no eating, no bathing, nothing. I'll be inside. Nobody will check on me, nothing at all. And then the third day, the voices, when it gets too much, all I do is to scatter things and do stuff. I tried committing suicide. Yes, I did it in the house. Nobody even checked on me. And I don't know, it was a surprise. The drugs I used in committing the suicide, I slept for 3 good days. And I woke up the third day, right in my room, alive, back to this world. And hey, I was alive again. And everything became so it's too much for me to the extent that I sit in taxis, wouldn't pay them because I want to be beaten. I want somebody to just beat me till I die. I can be standing somewhere, be in the road, people will be calling. I wouldn't even hear anything, nothing at all. It's like I'm walking, but I- I'm 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 not me. I'm not there at the moment. So fortunately, it happened for a while, and I met this nurse who took me to um, a psychiatric hospital, to be precise, Pantine, and I was put on antidepressants. When I came home, my friends, those a bit close to me that I told them about, were teasing me that I've gone psycho. It's only the mad people they take there. So I threw all my medications away, and things got worse. Things got worse. So the lady had to talk to me again. and then take me back. So I was admitted for like 2 months, given antidepressants, and then I came back. But then I wasn't able to come to my mother's house for so many years because of everything that happened there. And the fact that I still couldn't accept the fact that mommy was gone, because she was my only best friend. I didn't have any friends, like close friends that I could talk to till she died. So it all dawned on me, and everything was really difficult, very, very difficult. Walking from hospital to hospital, sometimes with a cannula, walking around looking for money. I thought I had gone mad actually, because I wouldn't bath, I wouldn't eat, nothing. Like, and I didn't care. I really didn't care how people saw me. I was, I don't know the word to use, but it was bad. It was bad.
This is like I don't know. It's so touchy, Celine, and because of our time, I would like you to just make a summary, and let's move on to our talk. I think during the question and answers, you come in again, because I know Dr. Asare might have a few questions for you to establish a
Okay.
point. Yeah.
Citizen, I think I'll end here.
Okay, thank you very much. Thank you for the story. I told you, in the African soup, there are a lot of meat and fish. Don't say one is not nice. Try everything and you see what is in there. These are very touching stories, and I'm glad and so appreciative that you guys were able to come to share. I'll call on a parent who is also here, who has gone through mental health issues. So I'll call on Mr. Johnny to share with us in a few seconds what his experience is. Hello, Johnny. Hello. Hello, Johnny. All right. So as we waiting to hear from Johnny, I would like my co-host to read the bio for the speaker for us, and we then introduce. Uh, Hello, I think Johnny is trying to speak, but hello. Hello. Okay, so Ms. Priska, please, can you introduce our speaker for us?
Okay, so our speaker for today is no other person than Dr. Asare, our one and only Dr. Asare. Yeah, Dr. Asare, your bio is too long, so please kindly tell us about yourself and let's move on.
Wow. Okay.
This is amazing, my co-host. Thank you very much. So, Dr. Asare, take us on. Thank you.
Okay. So I'm supposed to share my screen, correct?
Yes.
I don't know if you guys can you see my screen?
Yes, we can see. I can see your screen.
Yes, we can.
Okay. So
Yes, we can.
All right. Can you see the full screen? Or do you see two parts? What exactly do you guys see?
It's not on slide share.
Yeah, I think we can.
You
It's
see
two parts. So, like,
parts?
you can do slide share.
You can see two parts.
Okay, can you see the slideshow now?
Yes, yes, perfect.
Okay, so my name is Akua Asare-Danso, and I am a physician. I'm a psychiatrist, and I am part of this group because my husband has sickle cell. And so I joined this group in order to learn more about what is going on in the lived experience. I am a psychiatrist, and so I thought it would be a good idea to kind of talk a little bit more about the mental health aspects of sickle cell. So if you are ready to go, I hope you guys will have some questions. I hope you guys will have some comments. This is not gonna be your regular wah, 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 wah presentation. We're gonna get in it, we're gonna get dirty, we're gonna learn, and we're gonna be enlightened. So first and foremost, thank you so much to both of our ladies for sharing their experiences. It is not an easy thing to open your mouth and be vulnerable and transparent about the issues that you have gone through. So I just want to pause and take a moment and thank you both, not just for sharing, but I want to thank you both for surviving. I want to thank you both for still being present through the pain, through the suffering, through the darkness, through the stigmatization, through everything you have gone through. I want to say thank you that you are still with us. When we talk about sickle cell, we tend to focus on what we call the pathophysiology, meaning the pain, the acute chest syndrome, the hip necrosis, the spleen dying, and the strokes, and the red blood cell sickling. We focus on these sorts of things. But what we do not focus on, we do not focus on what we call the psychosocial factors. And that is why this presentation is so important, and why I need you guys to open your ears wide and open your hearts to prepare to listen to this, because I'm pretty sure you will see yourself today in what I have to say. Because these factors, the mental health aspects, are some of the most important ones, and you will see how they affect your pain experience. They affect your self-esteem. They affect who you are. They affect your very life as someone living with sickle cell. So let's look at sickle cell holistically versus focusing on only one or two things. So when we talk about mental health, and any you guys listening, let me know if I'm talking too fast, because my accent is different. People have told me I talk too fast. I'm trying to slow it down a little bit so you guys understand what I'm saying. But when we talk about mental health, WHO, the World Health Organization, defines mental health as a state of well-being, in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community, however way they define community. However, mental illness, which is what I, as a psychiatrist, specialize in, is something very different. Mental illness these are diagnosable, meaning they have very specific restrictions and definitions that we are looking for. Health conditions that originate in the mind. One, they have to be diagnosable, meaning there are specific criteria. Two, they originate in the mind. Three, these conditions cause significant major changes in your thinking, in your emotion, and your behavior that leads to number 4, major distress and or problems functioning in social, work, or family activities. You can have good mental health and be diagnosed with a mental illness. And you can have poor mental health and not have a mental illness. A lot of times people talk about, oh, I have depression. But when they use the word depression, they're not talking about a diagnosable medical condition. They're talking about a feeling or an emotion of sadness or being disheartened or being down or having a low sense of self. But they're actually not talking about the clinical diagnosis of depression. So that is something we need to understand from the top, that when I talk about depression, when I talk about anxiety, when I talk about psychosis, it is very specific. So when people say, oh, what do you mean you're depressed? We all get depressed. You tell them, hold your horses. Am I even talking to you? Do you even know what depression is? You don't know, so I beg, please keep quiet. You are talking about sadness. I am talking about a clinical, diagnosable condition. 2 very different things. Mental illnesses, we categorize them into these categories. I'm not going to go in depth into each of them because really, that's not what this presentation is about. This presentation is about how mental health manifests and shows up in the life of people who have sickle cell. But just because you guys are intelligent, brilliant, beautiful people, I want to drop this in your mind. Conditions that are mental illnesses are categorized in different buckets, as you can see. We have something called mood disorders. These are your disorders that affect your general sense of self, how you're kind of feeling, how you're moving through life. They can be depressed, they can be anxious, they can be bipolar. These have to do with your mood. Now, the anxiety ones are specific and different. The thing is interesting, some people can have depression and there's an element of anxiety in it, but it is not a separate category. Anxiety disorders are going to be what we call your generalized anxiety, your panic attacks, your social anxiety disorder, your phobias like fear of spiders or fear of snakes. Substance use disorders, everybody kind of has an idea of that. We're talking about your overuse of prescription medication, overuse of opiates, overuse of crack, cocaine, heroin, methadone, cannabis. That's what we're talking about. And even cigarettes, nicotine is also in this group. Your psychosis, these are the people that we often think are quote unquote mad or quote unquote crazy. Oftentimes you might see them walking on down the street, talking to themselves. Why? Because their world has changed. They actually see and hear things that the rest of the world doesn't. And having psychosis is very frightening. One of the things I want you guys to understand is that people who have mental illnesses are suffering. The person who is walking down the street talking to themselves, who runs when they see you, what is going on inside their head is frightening. They could be looking at you and all of a sudden your nose starts to grow or your ears start to change shape. Can you imagine if you were standing here looking at the wache seller and all of a sudden her hands turned into snakes? I beg, the way you would drop that wache with the quickness and run. That's the suffering they're going through. There are childhood disorders like ADHD. There are eating disorders where people feel like they are obese and but they're very skinny and they restrict their eating to the point of dangerous and dying. And then there are what we call personality disorders. You've heard terms like narcissistic. That's the area that those are in. Now, where does mental illness come from? That's a question people always have. What you have to understand is that mental illness is what we call multifactorial, meaning there is not just one thing that leads to somebody getting mental illness. It's not a curse somebody puts on you. It's not generational curse. It's not you walked in front of the wrong people. It's not the evil eye. Mental illnesses come from three major areas that we call bio, psycho, social. Bio stands for biological, meaning physical health, disabilities, your DNA, genetic predisposition. You guys know about sickle cell. You know that sickle cell is a genetic illness or condition. It is passed down in your DNA. In the same manner, mental health, mental illnesses specifically have a root in DNA, in your neurochemistry, meaning the hormones that are swirling around in your brain, even in your immune response. Sometimes you can have a genetic predisposition, meaning your DNA has been passed down, but you might get something and your sister doesn't, or your brother gets something and you don't. Because what we have what's called spontaneous genetic mutations. All that means is that your DNA can mutate, it can change all by itself just because, and it happens all the time. The second part is the psycho. That's your psychological part of who you are, what you believe, your behavior, your personality, your self-esteem, your coping skills, your emotions, your social skills, okay? So let's say you're a person who believes that in general, people are good. So the way you interact with people is to give them the benefit of a doubt. If they come to talk to you about something, you tend to be like, okay, you're more open. But if you grew up in a family or in a household that said, be careful of outsiders, they're up to no good, you can't trust people outside the family, people are not good, then you will perceive people as being deceptive. You will always hold things to yourself because you don't trust people. And that can make you more prone to anxiety because you're always worried about whether or not somebody's coming for you to do something to you, okay? So that's just an example of how your beliefs, your behavior, the way you interact with people, your general personality, if you're sunny, if you're kind of upbeat, or if you tend to see the darker side of life, how you see and perceive yourself, how you cope with things. Are you the kind of person that talks to friends and family? Or are you the kind of person that goes inside yourself and drinks alcohol until you pass out? Okay? Social. That's going to be your interactions with your external world. So your peers, your relationships with yourself, and that's interesting. A lot of people don't think about this, but guys, your first relationship that you ever have is with yourself. Who are you to you? What do you see yourself as? How do you see yourself? Your relationships with yourself will determine your relationship with others. It has an effect. If you don't like yourself, you will tend not to like other people. If you are always upset with who you are, you will tend to be upset with other people. We treat other people very much the same way we treat ourselves. So your peer relationships, your family circumstances, your cultural traditions, and this is big because you guys are living in Ghana. There are certain things and beliefs that you may not even realize you have. You may just think, oh, that's just how things always have been. And you don't actually realize that those have an effect on the way you are. Your social support, do you have social support? Do you have family? Your education, and of course, your financial status. And you can see the way these things intersect. So the biologic intersects with your psychologic to create your temperament. The biologic aspects can integrate with your social environmental. That can affect your drug effects and how you respond. So I took some time on this because a lot of people are mistaken that, oh, this is something that just came from nowhere, or, oh, you did this to yourself. Absolutely not. Now, let's be very specific to sickle cell. What are some of the mental health challenges that individuals who have sickle cell have? One of them is what we call body dysmorphism. And that simply means the way you see your physical body is negative. So individuals who have sickle cell tend to be generally on the smaller physique side. They tend to be a bit shorter, a bit leaner. If you're a guy, a young guy, a male growing up, the fact that you don't necessarily, you're not as tall, you're not as muscular can become an issue when all your guy friends are growing up and getting muscles and all this stuff. And you feel like, hey, what about me? Or they may tease you, the same with girls when you're growing up. Your body may not, flesh out the way so-and-so's rear end has fleshed out or bosom has fleshed out. And now you're upset and they're teasing you. So the way you actually see your body begins to warp. You no longer see your body as normal and natural to you. You begin to see it as inadequate, insufficient. Another aspect that is a concern is fatigue and appetite, specific to sickle cell. There's a lot of fatigue and tiredness and appetite issues, not wanting to eat, not being able to eat. And we know that these have major effects on your mental health because you need food to fuel yourself. Self-esteem. Now, this is a big, big, big one. People who have sickle cell tend to generally have feelings of inadequacy, meaning they don't feel like they're good enough, they're strong enough, they're smart enough, they're healthy enough, they're lovable enough, they're worthy enough. Their family and friends make negative comments. There's stigma in society. They have to deal with the pain and the crisis. And all of this tends to make them feel and have and experience low self-esteem. And that actually leads to poor general cognitive, that is your mind, functioning interactions with other people's and with yourself. They tend to be sometimes less sociable because of the lower self-esteem. They feel like they don't fit in. Nobody understands them. People are laughing. All of these issues that are coming up that lead to low self-esteem. And sometimes there's a certain element of irritability as well as aggression. The anger about having sickle cell affects every part of you. You're irritable, you're in pain, you're annoyed, you're pissed off, you're tired. And that can come off with increase in aggression and sometimes impulsivity. You say, you know, whatever, I'm going to die at 21. I'm going to die at 25. So, Chale, I'm going to do everything and anything and forget everybody else. And so now you're out there running these, you know, Tema streets on your motorcycle, just begging for death to come for you. You're taking risky behavior because you feel like my life is going to end anyway. There's social withdrawal as well, where you isolate. You don't interact with other people. You don't open up to other people. You go inside yourself and you stay there. There's also a fear of an obsession with death. We all know that we're going to die at some point, but individuals who have sickle cell are faced with their own mortality in a way that is different. They're faced with it at a young age. They watch friends and family members pass away. You know, they can have crisis, you never know. So there's always this sort of uncertainty and discomfort that is part of, unfortunately, the mental health challenge. And in fact, there are many individuals who have sickle cell who actually get to the point where they pull away from people who they should be more close to because they're worried. If I die soon, it will hurt this person more than if I stayed distant from them. And so they create an emotional distance from other people. There's also what we call pain catastrophizing. That simply means because of the nature of the illness, people with sickle cell tend to obsess and worry about the pain. There's a helplessness when they experience the pain. They're unable to set aside the worries or the thoughts of future pain. And so you end up meditating and magnifying the absolute worst case scenario. And you think to yourself, nothing is good. My life is horrible. There's nothing good in my life. My life will always be bad. When we think about one of the major mental health challenges is stress. Now, let me explain to you, stress is actually not a bad thing. I know, it's shocking. We all say it's negative, but stress is not a bad thing. Why? Because stress is actually made of 3 parts. It's a process. Stress is your body's response to some kind of challenge or some kind of a demand that is placed on you that results in a feeling of emotional or physical tension. Let me break that down. An event or a situation occurs. Your mind perceives that situation as a challenge, as a problem, as a difficulty. And because that's what's in your mind, that message is relayed to your body. Get ready. We are about to face something and it's gonna be tough. So what ends up happening is all these hormones are released and your nervous system revs up, and we have what we call hyperactivity, meaning your nervous system is more active than usual and your stress hormones are pulsating and they're getting you ready for whatever is going on. And normally that's used for fight, flight, or freeze, meaning whatever situation you're about to be in, you're about to fight it. I'm about to take it on. What? Let's go. Or you're fleeing it. Charlie, I'm out, so I don't have time for this. Or you're frozen. Okay, if I just hold on and watch the outcome, I can figure out what's going on in this dangerous situation. Now remember, it's a process. So there's the event. And the event, guys, the event could be something good. It can be a wedding. It could be a job promotion. It could be moving to another state, another city. It could be, you know, getting your degree. It could be anything. But your mind sees it as a challenge or a demand. And it could also be something difficult like hospitalization, crisis, dealing with family problems, finances. But your mind perceives and sees something a certain way, and that revs up your body to get ready to deal with the challenge. So you end up with blood going to places that are needed, like your brain, because you need to be able to have oxygen to be able to figure out what's going on. And other places, the blood doesn't go as much. So it's not going to go to your abdomen. It's not going to go to your gut. It's going to go to your lungs and your heart, because your body is saying, I have to be ready for whatever is going on. And so we feel like chest heaviness, and your breath is faster. You have these aches, these chest, shoulder, neck, back pain aches. You get these headaches. You're grinding your teeth, you're clenching your jaw. You feel dizzy. You have nausea and vomiting. These are what happens when you have chronic stress. Stress in and of itself is not bad. Your body's response is good because it's prepping you to deal with a challenge. But stress is not meant to be with you forever. You're supposed to release it, get your body prepped, deal with it, and move on. Like when you have a test, and right before the test, you're like, okay, I'm good. I studied last night. All right, let's do this. So you start feeling it, and you're sitting there in front of the exam, and you're marking, yes, I know this, because the blood is pumping to your head like, you got this, man. You studied. This is all yours. You are going to rock this. But when it's done, everything is supposed to fall back because you don't need it anymore. The issue is when this process stays constant and consistent. So then you will find stress in various areas, in the physical aspects, the fact that there is pain, the fact that there is weakness, the fact that you are actually anticipating what the pain will be like. What a lot of people don't know, and I'm going to drop this to you now, is that the actual anticipation or even the thought of, the worry about pain actually causes your vessels to narrow. Okay? And we all know that the last thing we need is the vessels to narrow, because then the blood doesn't get through, the sickled red blood cells start sticking. So actually, physical stress, feeling stressed about your job, feeling stressed about a relationship, feeling stressed about finances, leads to your body responding by narrowing the vessels. What does that do? It increases your frequency and intensity of crisis. So you can see how just having a regular stressful situation can actually precipitate a crisis and you didn't even know it. Financial issues, medications, treatments, hospitalizations, where's the money coming from? Occupational issues. What career am I going to go to? What are my options? Will I have job satisfaction? Will I grow in my job? Will I have missed days? Educational issues. I have exams. I have to lay on the floor for this exam because I'm in so much pain. I can't do the homework. The homework isn't coming. You know, the teacher doesn't believe me that I'm in pain. I have missed days from school, so then I can't finish the semester. And of course, relational, meaning your relationship to yourself can cause you stress. Your relationship with your parents, with your siblings, with family, with friends, with lovers, romantic partners. You have feelings of guilt with your parents. Maybe you're angry at your parents. You're totally upset, right? But then you also feel like I shouldn't feel guilt. You know, I feel guilty because I'm upset. You know, issues of wanting of intimacy. You're not close to friends. You're not close to family. You're not close to your lovers. In fact, people who are single with sickle cell are hesitant and very cautious to go into relationships and normally do not want to go into relationships. And what is important to know, guys, is that although you may want to withdraw, research and science shows us that withdrawing and not having quality social support lowers your entire quality of life. So you may think staying by yourself all the time is helping you. Actually, physiologically, it's not. So how do we manage these things? How do we manage this stress? I think this quote is really excellent because the more, you have to understand, the more the sickle cell disease interferes with your living normally, the greater the risk of psychological dysfunction. So the more severe the sickle cell is, the more pain you have, the more crisis you have, the more complications you have, the more transfusions you have, the more weakness you have, the greater the risk of you developing psychological dysfunction. So then it goes hand in hand that we need to make sure that people who are living with sickle cell are getting appropriate treatment for the sickle cell disease, the pathophysiology, the pain, the crisis, the problems with the eyes, the lungs, the skin, and making sure that there's no psychological, or you decrease the psychological impact. So what can you do? Talk with your close friends and family. Even if there's only one who loves you and cares for you, talk to them. Open up to them. Lean on them. Maintain routines when you can. Focus on positive activities. Remember, in your mind, if you are constantly thinking negative, your body will respond as if it's constantly in crisis mode, and that will increase your intensity, frequency, duration of actual getting a crisis. Acknowledge your feelings. People in Ghana don't want to acknowledge, Africans in general. What is a feeling? What are you talking about? Please, who cares about that? But feelings are part of your human nature, and they're there to let you know something. Feelings are flags. They're messages to yourself, from yourself, to say, hey, hold on, stop. You're feeling happy. Something good is going on. You're feeling sad. Something difficult is happening. You're feeling angry. They're telling you about what is happening inside you and around you. So acknowledge that you feel these things. You don't have to stay in that place if it's a negative place, but you must first acknowledge that it exists. You guys know about these: keeping a healthy lifestyle, proper diet, exercise, sleep. We've had lots of different, let's talk about this. Not using alcohol, not smoking, not using drugs. You guys know that. But also disconnect from some social media. I know we love social media, but there's so many bad things that people are posting, so many things that are happening. You need to disconnect. You need to pull away from social media. You've got to do it. Seek accurate information. Just because somebody's uncle's prophet's, youngest son said that if you drink mud, it will help you. You can't always be dependent on stuff that people are always saying, even if you get desperate, right? If you're in chronic pain, you're looking for something, anything, you will go for anything. But sometimes in the going for anything, we discover we've made our situations worse without knowing it. Talking to counselors. I know mental health and psychiatry and therapy is not a big thing in GH, unfortunately, and I wish it was. I wish there was more of a focus on that, because as a psychiatrist myself, I have counseled and done therapy for people all the time and enabled them to open up and realize things about themselves, and it's freed them to actually live better lives. using coping skills, healthy coping skills, making sure, of course, safety and hygiene, we all know about that, and making sure you have enough food, water, things of that nature, your basic activities of daily living. Now I want to focus specifically on mental illnesses that are found in people who have sickle cell. These three are your big three. When it comes to depression, there's a lot of stuff on here. You guys can read this yourself, but I'm just gonna read them out loud so you understand when I said this is a diagnosable, meaning that it has specific criteria to be diagnosed by me as having depression. You must have at least the following. You must have a depressed mood, meaning you are down and out almost all day, every day, for at least 2 weeks. This is not, I'm feeling kind of sad, but I can laugh, I can joke. No, this is your mood is low, you are down, you are sad almost all day long, every day for at least 2 weeks. So you have to have at least that or something called anhedonia, which means you have no pleasure in any pleasurable activities. So there are things you like. You like to listen to music. You like to, dance. You like to read. You like to do it. But you find yourself when you pick up a book and you look at the book, you can't read it. There's no pleasure in reading the book. There's no pleasure in cooking. There's no pleasure in talking to people. The activities that you find pleasurable, you can find no pleasure in. So if, let's say, you like dancing and then I'm just tired, I don't feel like dancing today, that's not anhedonia. Anhedonia means no interest in pleasurable activities at all. You must have at least the depressed mood or the anhedonia all day, every day, for at least 2 weeks, plus 5 of these things that are listed. Insomnia, you can't sleep or you sleep too much. Feelings of inadequacy, indecisiveness, inferiority, guilt, low energy, chronic fatigue, inability to concentrate. And this is not, oh, I can't focus. This is your mind done scatter. You can't concentrate on anything. You can't remember things. You could be sitting there talking to somebody and all of a sudden your thoughts just disappear. You're not eating. You have no appetite. You feel hopeless. And I don't mean hopeless today, hopeless in this moment. I'm talking again, chronic feelings of hopelessness, low self-esteem, social withdrawal, negative thinking. Negative thinking is my life is horrible. Everything is horrible. I am the reason why people are upset. If I just died, everybody would feel better. You have to have these things, okay? Anxiety is what we call when you have excessive worry. And I mean excessive, I mean you are just constantly worried about everything and anything. Not that you're worried about the pain or you're worried about how to pay your bill. You are worried about the sun shining tomorrow. You are worried about, does this person like me? This person looked at me. What does that mean? What did this person think? What are they saying? And there's no specific threat, meaning if you're anxious because a car is coming towards you, you have a reason to be anxious. But if you're just anxious, you're just sitting there and all of a sudden you think about something and then you just start popping, your heart starts beating faster, you can feel the things inside your tummy. Your worry is uncontrollable and your worry shifts. And you met those people, they'll tell you about one thing and you'll say something positive and then they'll shift to what about this? And what about this? And what about this? No matter what, they're always shifting. And you can tell physically it shows up. They're edgy, they're restless. They get tired much more easily. Their mind also goes blank. They can be irritable. In sleep, they can't fall asleep. They can't stay asleep. They can have things like nausea, diarrhea, sweating. And they always, 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 always need reassurance about everything. Not reassurance about, are you going to show up here? Are you going to sure? But they need reassurance about my shoes and this and this. And they need reassurance about everything. And then insomnia, many of you guys have experienced this, where you have dissatisfaction with sleep quantity or the quality. So you may be sleeping, but you're always waking up. You're having nightmares, you're having disturbing dreams, or you're not sleeping at all. So you can't fall asleep. You can't stay asleep. When you wake up, you can't get back to sleep. You wake up early in the morning, you can't get back to sleep. So these you have to have at least 3 nights a week for at least 3 months, despite what we call adequate opportunity to sleep. Meaning, it's not like you've changed shifts and you're working the night shift, or you travel to another country or something like that. You are able to sleep, you have a place to sleep, you have a bed, but you can't sleep. It's not due to drugs, medications, it's not due to abuse, it's not due to another disorder like depression and anxiety. You have to have those symptoms for at least 6 months with at least 3 of those physical and cognitive symptoms that I talked about. Really quickly about depression. What is really important for this slide right here is that in depression, people who actually have depression, there's this cycle where the pain right here, and this is the sickle cell. Remember, I'm focused on sickle cell here. The pain is in the center of this, right? So you have this pain and you can't sleep. So you also have anxiety because you want to sleep, but you can't sleep. So not sleeping actually makes the pain worse physiologically. And then you lower your energy. Now the chronic pain is, putting these limits on your life, and your mood changes. You get anger, you're anxious. Those feelings actually make it harder for you to cope with pain. So having more positive attitudes, more positive perspectives actually decreases the intensity of pain. You may not believe me, but believe me. Pain affects your activity. You can't move around as much. You don't have the energy. It's hard to be active. And when you don't exercise, that actually makes the pain worse. Energy, the pain, just coping with the pain itself will drain any little bit of energy that your banku that you ate yesterday will give you, okay? And that lack of energy makes it hard to be active and stay in shape. And people who have this depression and sickle cell disease, on the left-hand side, you see how it affects everything. It worsens your daily pain. Your quality of life is worsened. Your quality of mental life is worsened. People who have depression and sickle cell use the medical resources even more, and they have higher healthcare costs. So you see how depression affects every part of this. Sickle cell disease, people who live with sickle cell disease actually are 5 times more likely to suffer from depression than those who also have chronic medical conditions. People who have diabetes, high blood pressure, cardiovascular disease. People do not have as high rates of depression as people who have sickle cell. The chronic pain is associated with that depression, right? And the negative perceptions and mindsets lead to you actually not adhering sometimes to what you're supposed to do, not following up. Depression actually reduces pain relief when you use medications. I know it sounds crazy, it sounds wild, but it's true. When you have the clinical diagnosis of depression and you're taking pain meds, the effect of the pain meds actually decreases. Okay, so depression is associated with more hospitalizations, more ER visits, more transfusions. Again, the more severe the sickle cell disease, the greater likelihood of developing the depression. And people who have poorer social support, you don't have people in your corner. If you have people in your corner, whether it's in your family, your friends, your romantic relationships, hold on to them and lean on them, because having strong social supports actually decreases the development of depression. Up to 30% of people who have depression experience suicidal thoughts, and up to 10% have tried to commit suicide. Okay? So what do? We try to help with early diagnosis, with therapy, with support groups like Sickle Life, which does an absolutely amazing job. Hats off to the admin. And normally the way we treat depression, if you have sickle cell, is the same way we treat it if you don't. We have psychotherapy where you actually talk to someone to develop techniques to help you shift the negative thinking. The depression brings negative thinking, okay? So we have to shift the negative thinking in order to shift the effect of the depression. There's medication, antidepressants, mood stabilizers. There's mind-body medicine, which is lifestyle changes like exercise and meditation. Now, anxiety. Look at that loop right there. Increased anxiety actually increases your pain. I know it sounds crazy again. You're like, what? I'm anxious. What? Physiologically, there's an effect of increased anxiety increases your pain. It increases your experience of stress. Remember, we talked about stress and the 3 parts to it. And stress, what does it do? It constricts your vessels. You need your vessels to be open already, but it constricts your vessels. And then it causes it to be chronically even more constricted than when you have crisis. So that's gonna what? Precipitate more crisis. You get more crises, and that's gonna do what? You get more pain-related distress. What does that do? Higher admission, more painful episodes, and we start the cycle again. So what do? Again, we seek professional help. Talk to a doctor, find someone, a therapist, a counselor, someone you can trust. Don't just go to talk to someone just because. They have to be someone you can trust, because you can be more hurt by the wrong person than by the right, okay? Practicing healthy lifestyles, of course, resting, meditation, 15 to 30 minutes of some kind of activity a day. Avoid isolating. You're gonna hear me keep saying that. When I have my patients and they're depressed, the thing they wanna do when they're anxious is the thing I don't let them do. They wanna stay at home and not interact. And I tell them, you gotta go outside, okay? Because the depression and the anxiety is pushing you to do something, so you have to reverse it in order to get you back on track. So be aware of negative thoughts. Write things down in your journal. Write them down. Do you write poetry? Write poetry. Are you a rapper? Rap. Recognize what is triggering you. Is it the thoughts? Even the thought of the pain gets you all anxious? Recognize those things so that you can stop them at the pass. Cut them off at the knees. And it is a practice, guys. This is not something that's gonna come to you to say, right now, today, but it's something that you develop over time. Sickle cell has been with you since you were a child. The way you cope and deal, you have to put that into place. Don't get discouraged. Keep using these things. Be patient. Welcome humor. Practice self-care and compassion. And we'll talk about self-care. Self-care is some of these things right here. Visualization, taking a walk, spending some time in nature, listening to music, breathing deeply, getting a massage, meditating, seeing a movie, soaking in a warm bath, laughing, reading a good book. Insomnia. The thing about insomnia is that sleep deprivation is crazy impactful. It's caused by medical conditions. It's caused by medication issues, problems with your circadian, which is what we call your sleep-wake cycle, issues in your actual environment and with people you love and people you're around. In fact, these are some interesting facts for people who have insomnia. And it's kind of wild. People who have insomnia are 35% more likely to get divorced. They're more likely to earn lower incomes. They're more likely to distrust doctors' recommendations. They're more likely to smoke. They're more likely to feel uncomfortable discussing health concerns with the doctor. They're more likely to take prescription drugs. And they're more likely to be unemployed. More than 70% of people who live with sickle cell have insomnia. They are tired, they're fatigued, they have poor concentration, they have problems falling asleep, even if, they're napping. And the insomnia actually has a relationship to depression and pain. Risk factors. There are certain things that make you more prone to develop insomnia. Things like depression, anxiety, medications, family stressors, work-related events, health events. But insomnia itself can cause and be effective on depression, on anxiety, on alcohol and drug dependence, because you're drinking and you're taking something just to knock you out all the time, and suicide. And interestingly enough, your mortality, your risk of death in general increases if you are consistently sleeping less than 5 hours a night. I know, you didn't want me to tell you, but I would be lying. I wouldn't do right if I didn't tell you these things, okay? So what is happening with insomnia? Why is it going on? Are you guys ready? I hope your ears are open. I hope you're not bored. I hope you're not sleeping. I hope you're with me on this one. Essentially, what's going on? You are hyper aroused. You are hyperactive inside yourself. Your brain is always on, all the time. You have increased brain activity. You have higher daytime and nighttime body temperatures. You're constantly releasing stress hormones. And because of that, the insomnia is actually just the way the hyperarousal shows up at night. You don't realize it during the day because obviously you're awake. But the same overstimulated brain stays overstimulated at night, and it causes insomnia, and then we're confused and we don't know what's going on. Okay? So the more you try to sleep, and this is my quote, the more you try to sleep, the more agitated you become, the less you can sleep, the more obsessive you become about sleeping, the more you try to sleep, the more agitated you become. So you see what's happening. There's a trigger. Oftentimes for many people who live sickle cell, it's the pain. It happened when you were small. The acute crisis, some other stressor is the trigger. So now you're thinking, you're worrying, remember excessive worry about the fact that I'm not getting enough sleep. It's a problem. And then that worry leads you to start, you're laying in the bed, you can't sleep. So what happens, you may not know this, but unconsciously, your mind is now equating bed and nighttime with I can't sleep. So you could be sleeping in somebody's house, you could be sleeping in a hotel, you could be sleeping in your own bed, but your brain is like, a bed equals I can't sleep. And so you now associate sleeplessness with bed. on all these other behaviors. And then you become hyper focused. I need to fall asleep. I need to fall asleep. I need to fall asleep. And that obsession gets your mind even more aroused. And now you can't sleep because you're trying to figure out how you're going to sleep. And then you try to do things. You try to sleep in the morning. You try to do daytime naps because you're like, I got to get sleep somewhere. But what that does actually disrupts what should be the normal cycle of sleep. When you take those sleeps and those naps, it decreases what we call your sleep hunger. And so you come to the evening and your body's not hungry for sleep. So what can we do? Keep a consistent sleep schedule. Get up at the same time every day, even on weekends or during vacations. Set your bedtime early enough that you can get at least 7 hours of sleep. So say you tell yourself, okay, if I have to get up at 5, backtrack 7 hours, that's when I need to be trying to sleep. Don't be in the bed unless you are sleepy, which is hard. I know it's very hard. Listen, this sleep hygiene stuff that I'm telling you guys, it's not easy. I know it's not easy, but it's about practicing. If you're laying in that bed and you're not knocked out 20, 30 minutes, get up out of bed. Do something that's relaxing, okay? Relaxing. Don't pop on, get on that social media, that blue screen. It'll just keep you awake. Read a book in a dimly lit room. If you do want to watch something, make sure it's not stimulating. You're not watching some violent movie or something like that. Make sure you have a routine that tells your body, okay, and your mind, I'm home, I'm getting ready to sleep. So change your clothes into your pajamas. Listen to relaxing music. Read a magazine or a book. You can use soft music or meditations. Only use your bed for sleep and adult activities. Make your bedroom quiet and relaxing. You need to keep it a cool, comfortable temperature. A hot room, you can't sleep in a hot room. Limit the bright lights in the evenings because what they do, those bright lights tell your brain, stay awake, stay awake. Turn off electronic devices at least 30 minutes before bedtime. And I know a whole bunch of you are shaking your head already at me like, I'm not doing it. But hey, I'm giving you these tips. Don't eat big meals before bedtime. Exercise regularly, maintain a healthy diet, no caffeine, no alcohol. Substance abuse disorders, you guys already know about this. This is the last thing I want to talk about. It's something called pseudo-addiction. What it is very simple. You don't get your pain relieved. So you become focused on trying to get the pain meds. And the doctors think you're drug seeking, but you're not. All you're trying to do is get your pain addressed. You're not getting the dosing. You keep asking for it. It's overlooked. So then you do things to let people know. You're moaning, you're grimacing, you're crying, you're yelling, because you're trying to get somebody to see you, that you're in pain. But these doctors, these nurses, they have their biases and these crazy beliefs. And so they're like, oh, this person is faking it. They don't give you the pain meds. So then you're like, well, I need to find this pain, medication some way, somehow. And that's when you start seeing people drug shopping. You start seeing people administering other pain relieving drugs. If the doctors and the nurses just gave the proper pain meds, you guys would be fine. So how do we deal with all of this at the end of it all? This is my last slide. Education. We have to educate our parents for them to get involved in helping their children with coping strategies, but not avoidance, not catastrophization. It's horrible. You'll always be sick. Pampering parents cannot put their children in a bubble You can't do that. Your children are people. I know you want to protect them. Teach them how to live well. Don't focus on the sickle cell. Don't make their lives about sickle cell. Tell them they're beautiful. Tell them you love them. Tell them they're awesome. Tell them they're amazing. Tell them they're great. Tell them they're intelligent. Tell them they're strong. Tell them they're awesome. Tell them you love them. Don't make their entire life about the sickle cell. Don't define them by the condition. Let them live with the condition. Don't let them be the condition. Mothers and fathers listening, I need you guys to get this in your mind. I need you to, yes, be with them, hold them close. Tell them you have to be cautious about this and that. Help them incorporate the condition into their lives. Don't make them their lives all about the condition. And you mothers and fathers, you have to address your own anxiety. You have to address your fear because your children are feeling it. They are sensing it. They know it. You have to be a champion for your children living their best lives as children. And you have to address your emotions, your anger, your pain, your sadness. You have to address it for yourself so your children don't grow up bearing your pain. You have a responsibility to yourself to do self-care. You have a responsibility to yourself to see your children not as sick, but as beautiful. You have a responsibility to yourself not to beat yourself over the head because, oh, if I had known, the bottom line is now they are here. Now they have the condition. Focusing on the if I had known, staying in that place of guilt will only shame you and shame them. Let's switch our focus. Self-educate. You yourself who have sickle cell, take the time to educate yourself. Be your own advocate. Don't wait for somebody else to advocate for you. This is your life. You know your body. Open your mouth and say, let me explain something to you. This happened, this happened, this happened. If you're in crisis, write things down. Write it down before the crisis comes. Pull it out. Say, please read this. I know it's hard. I know you're in pain. You just want it to be dealt with. But there's an element of this where you have to open your mouth and sometimes you have to say, listen, I need you to help me out. Unfortunately, the Ghanaian healthcare system does not seem to want to help people out, but we have to try. We have to look at the way we think about ourselves, okay? And I'm gonna stop and park here, right here, right here. Guys, your first relationship is to yourself. If you think you're a bad person, you're gonna act like you're a bad person. If you think you're nothing, you're less than, you're nobody, that's exactly what you're going to be. If you can look at yourself and say, I am beautiful simply because I am. I am beautiful simply because I am. I am excellent simply because I am. I am worthy of love. I am valuable. I am excellent. Yes, I'm a human. I have issues. I have concerns. But simply because I am a human, I am worthy of love and attention and goodness with or without the sickle cell. Lean on that social support. I'm telling you, you've got people in your life who love you. You've got people in your life who care about you. Pull them in. If they are willing to be in that space with you, let them be in that space. Don't be cutting people off because you think this person won't and this person can't. If they love you and they're there and you've watched them and you see, open up a little bit, open up a little bit, open up a little bit more. learn to trust. Increase your expectations of yourself. I can do this. I will do this. I am doing this. You may not know this, but individuals who are married and have sickle cell actually get more support and help from their spouses if they let them. Try to develop closer physician-patient relationships. If you have a doctor who's really good, Dr. Bankas is on here, she's on it all the time, reach out to her, talk to her, say, how you doing? Are you good? Help me out. And of course, making sure you have appropriate pain management and appropriate psychotherapy, increasing your coping strategies are all necessary. Thank you guys. I really hope this was helpful.
Thank you so much. Gracias, merci, Dr. Asare. Actually, this should have been a face-to-face presentation where we could have seen each individual's emotions and how this education has sparked up so many things in some of us, especially me. It's sparked a lot of things in me right now, and I've done a lot of learning from this. We've exceeded our time. People here, we know we've exceeded our time so much, but it seemed that the talk was so great that we wanted to hear more. So on this note,
I apologize.
All right, we understand. So at this moment, we'll just take about 5 to 10 minutes to take questions and give answers. If there is more, you can channel it through our Facebook page, our Instagram page, our LinkedIn page, or our support group page, and she will give an appropriate answer there. The first question I have here is, you were talking about exercising, and the person is asking, what kind of exercise can people living with sickle cell engage in that won't overwork their bodies? What kind of questions? Exercises, sorry.
So exercises that you can do that don't overwork your body. So you know your body best. So if, let's say, walking is a great exercise, you want to maybe, if you jog, that's a possible one. Dancing is a great exercise. Doing strengthening, okay? I know this may sound funny, but if you have a can of tomatoes, one of those big cans, just doing like biceps, you know, and overhead and these sorts of workout, because you don't just want to work on your cardiovascular, you also want to strengthen your body. So even like abdominal exercises, core exercises, leg lifts, focus on not just increasing cardiovascular, but also strengthening exercises. And when you feel your body telling you stop, my friends, stop. Swimming is also a good one too.
Thank you very much. If you say swimming, I like swimming a lot, but I don't know how to swim.
Wow,
it's also cold. So we are always cold. So like, no, I won't do it, but I know many people would like to swim. Someone raised their hand. Celine, if you, can you unmute yourself and ask your question? Someone says, thank you very much for this education. It was a pure therapy session. And someone is even asking for the slides. I don't know, it's your intellectual property. So if you can give Sickle Life ahead, the go ahead to share with our members, that one is per your prerogative. So you can let us know. Yes, Celine, can you ask your question, please?
Doctor, please, I wanted to ask, I was put on medication whilst on admission, and last year, the last time I went to the psychiatric hospital was last year, and then I was given medication. Actually, Pantine wouldn't let you see your medication. You go for your folder, and then it's given to you. You come home and you take it. You don't see the pack and all that. I didn't go back for my medication again. I was supposed to go a month later, and it's been we are in March, 2 months to 1 year. Can I still go for it, or it isn't necessary again?
The thing is, it depends on whether or not you're experiencing the same symptoms. If you're still experiencing symptoms, you obviously have to go back. I would say go back to get a checkup, you know, and just to see what's going on. So go back, get a checkup, see if your symptoms are still there, and if you need the medication. And if you do, take the medication. But please try to get the name of the medication from the doctors. Get the name of the medication so you can Google it, see what it is, see how it's supposed to help you, so you can be able to advocate for yourself.
Thank you very much for the answer. Someone is just making fun of me here. They are warm indoor pools, so I can swim. I'll drink all the water before you come. I'm done drinking the pool water. So thank you very much, Auntie Emilia. Do you have any question? Please, if you have any question, you can ask. We have just some few minutes to leave. You can ask your question. And thank you very much, Dr. Asare, for the last part of it, especially. I wish my mother would have known this about 30 something years ago with what you were mentioning, because it seems most people that I've talked to, I've come across to, is the motivation from parents and the support. The support has never been there. So most people have been let down. And you know, there's this proverb in Ghana, or there's this wise saying that if you tie a sheep to one place for a long time, even if you untie it, it will still be there standing, thinking it's still there. And that is always on most people with sickle cell I have come across, or I'll say myself, because we feel that inadequacy, we feel that like no one just, it's there for you. The person will be there today, you cry so much and like the person is angry and gone. So okay, let's everyone be there. So thank you very much for those last points that you made. It seems you made a lot of recommendation, especially on insomnia and so many other things. And I think with time we'll still invite you to come and talk about all those things one after the other. Suicide, like insomnia, how to work about insomnia, depression and stuff. I know they are very big topics and we have to delve deep into it. So we are looking forward for International Sickle Cell Day and inviting, I said Sickle Cell Day, sorry, Mental Health Day. And in the course of the time, we would we invite you to come and talk to us. As of now, someone is saying that most times I sleep after 2 a.m. and wake up around 4 a.m. You are me in copy, okay? It started when I was about 13 years old that my dad threatened to kill me. Please, what should I do?
Wow. Whoever that person is, can you send me their direct, because that's a deeper topic. That's something that we probably need to talk to one-on-one. But I think part of this is you've already started. You've recognized that there's a relationship, right? So when that situation, unfortunate, tragic situation happened, it most likely has caused something called PTSD, post-traumatic stress disorder. You most likely have that. And so that's a conversation we need to have one-on-one. So citizen, if it's okay with that person, send me their information, or that person, I'm on the group, you know me. So just send me a private message. Let's talk about this, okay?
All right, thank you very much. Thank you very much. I'll call Dr. Bankers to also give us the questions on Facebook or Instagram if we have any there. But someone too here is saying, can you briefly touch on insomnia and how it's linked to sickle cell? Because the person is having an argument with the aunt about sickle cell and insomnia, how it relates. So I think these questions are very important, and I know we can waste the whole day talking about it. So as I said earlier on, these questions will be delved into very deeply as time goes on either our platform or there will be a session like this where we'll talk most this. I have acknowledged some like suicide, depression, insomnia, and those things. So we'll give time and opportunity for Dr. Asare to come and talk about it for us. So Dr. Bankas, please, can you come in?
Yes, Dr. Asare, thank you very much for the presentation. It was brilliant, touch on everything that's important to us. And the pseudo-addiction, I mean, we don't really think about it or consider it, but then it's such a huge issue. So I'm really grateful that you spoke about that as well. From Facebook, Ifia and Ankuma says, so emotional and touchy story, Celine. Pray you find strength. Please do take care of yourself. Blessings. And then we are with you listening to all the details. Thank you. And that's the only comments we have from there. So thank you very, very much. As Kofi said, we'll continue the discussion on our various platforms. So please send in your questions or comments, anything that wasn't too clear to you that you want Dr. Asare to elaborate on. Kindly post on our support group, and then we'd continue this discussion. Thank you.
All right, thank you very much, Dr. Bankas. So on this note, I think there's one or two comments here. Madam Emilia said that's very true. Support is very important. Some of us have very strong support system, and that keeps me going till now. Someone also said very educative. Talking about the slides, I think I'll send you an email to ask if officially we can get the slides and give to people who would want the slides, or if you can give it out to us. I know it's an intellectual property, so it maybe you have to register it or do something to it before you give it out. So if there is no question here and no one raising their hand, then I'll say a very big thank you. If my co-host is here, can you please give the vote of thanks so that we call it a day? It's
Kofi,
yes.
before the vote of thanks, also the recording will be made available in the next few days. So for everyone asking for the slides, just check out Sickle Live social media. The full recording will be on there, so you can go through the session again and then pause, rewind, watch everything again, and then make some notes. So that will definitely be available soon. Thank you.
Thank you. That is absolutely perfect. Thank you for that.
Okay. Okay, so Dr. Asare, thank you very much. Brilliant presentation over there. We've learned a lot, but I still have more questions to ask you. But we'll do that later. Thank you very much, Citizen Kofi, my co-host. Dr. Bankers, Mr. Johnny K, I see you too. Everybody on the platform, thank you very much for making the time with us. Thank you very much for joining us here. We love you. God bless you. See you next time. Same.
Thank you very much. See you in 2 weeks with a new topic. Stay blessed and stay safe. Please, everyone, stay safe. It's very important. Stay safe.
Hello.
Thank you.
Bye.
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 Bye.